The next skill that we're going to perform is going to be pulse and respiration. You're going to knock on the door before you enter because you still need to provide for your residents' privacy. So we're going to knock on the door. Even if she does not answer, that does not mean you can't go in. So you would knock on the door one more time. And then you would open the door. And you're going to close the door back. You're then going to pull the curtains. Go up to her and I'm going to introduce myself and give my title. Hi, my name is Teresa. I'm your CNA for today, and I've come to do your pulse and respiration. But first, I need to step away and go to the bathroom and wash my hands. So now I'm going to re-enter her room after I've washed my hands. I'm going to check her armband to make sure this is the person that I'm looking for. And you notice how I wash my hands before I check her armband because you don't want to promote germs. Now, what I'm going to do is take your pulse and respiration. You need to explain to her what you're doing throughout the procedure. You want to turn your watch around so that you can see the minute hand on it. You're going to count her pulse for 1 minute. When I say stop, you will stop counting the pulse. You would then go directly into counting the breathing, and the breathing is going to be when her chest rise and fall. Right now, I'm not going through the skill directly as it should be. I'm telling you what you should do, and then we'll do another dry run from beginning to the end, and you need to follow along. I've finished counting her pulse beats, but you would leave your fingers on the wrist so that your resident thinks you're counting the wrist beats. Because when a person knows that you're counting how many times they breathe, they usually will not breathe normally. So the minute is up for the pulse. You would then look at her chest, her shoulders, or her stomach and count her breathing for 1 full minute. 1 inspiration, 1 expiration equals 1 respiration. So now I'm going to count the breaths for a minute. Okay, I've counted your pulse and I've counted your breathing. Now I'm going to go wash my hands and I'll be right back. I'm going to give you your call light here, okay? I'm going to go ahead and write your vital signs on this paper. I'm going to write your pulse down first. And then I'm going to write your respirations, which are your breathing. 1 inspiration, 1 expiration equals 1 respiration. So I've written down what I got here, and I'll let the nurse know about it. Again, my name is Teresa. I'm your CNA for today, and if you need anything, just give me a call, okay? So I'm going to pull your curtain back so you don't feel closed in unless you want me to leave it closed. Okay, I'll see you in a little bit. Okay, you just seen pulse and respiration. And on that skill, when I came in, I did say to her, I'm going to do your pulse and respiration. But that is a training tool for your benefit. This is the way it is really supposed to be done in real life. When you're taking the test, you do not say pulse and respiration. Because if you let that resident know that you're doing their respirations, they may not breathe normally. And when you get to the test site, if you say pulse and respiration, you're going to fail. So do not let them know you're doing the respirations. I only did that for your training purpose. This is how it should really be done. You would check her armband and let her know I'm here to do your vitals. And then you would ask her to let you see her arm. You would then count the pulse here for a full minute. Then you would look at her breathing and count it for a full minute. And then you would go and wash your hands. And then you would come back and you would write it down on your paper. And you would give her her call light. And if she asks you what was it, you just let her know. A nurse will be in to talk to her in a minute. Because if you tell her what the signs were or what the count was, she will ask you, is that high or low? And if you say high or low, one way or the other, then you're making a diagnosis, and that is not in your scope of practice. Now, for the pulse, normal range is between 60 to 100. For the breathing, normal range is between 14 to 20. Anything below 14 is abnormal. Anything over 20 is abnormal. With the pulse, anything under 60 is abnormal. Anything over 100 is abnormal. And anything that is abnormal, you need to know to report to the charge. The video that you just watched, you saw pulse and respiration, but I just want to give you a close-up of how you actually find the pulse. You would pick up your person's arm, make sure that you do not touch them with your thumb, because your thumb has a pulse of its own. You never take the pulse with the thumb. You turn where the thumb is up toward the ceiling. You're all the way down to the wrist. You're going to hold your two fingers here for at least a minute, and you notice my thumb is not touching her. After you have counted the pulse for at least a minute, you would leave your fingers in place, and then you would count the respirations as I showed you on the video. The only material that I need for transfer is my gait belt. And the gait belt should be worn at all times. It's a part of your uniform. So I'm outside in the hallway. I'm going to knock on the door. Close the door. And I'm going to come over here and introduce myself to my resident. Hi, my name is Teresa. I'm your CNA for today. And I've come to do your transfer. I'm going to get you up in your wheelchair so you can go to physical therapy. First, I'm going to go wash my hands, put my gloves on. I'll be right back. So I go into the bathroom, and I'm going to wash my hands. You know, you really would wash your hands for 30 seconds. I'm going to check her armband, and this is who I'm looking for. Okay, Miss Smith, I'm going to gather your materials after you check the armband. And the material that I need inside the room is her wheelchair. So I'm going to go into her closet, get her wheelchair. I want it to be catacorn to the bed. I want these hands to be next to the end of the bed, but do not remove your hands, both of them, off the wheelchair at the same time. So you're going to lock this wheel, put your hand back on the wheelchair, lock the other wheel, put your hand back here. At this point, you can take them both off because both of the wheels are locked. You would remove the legs out of the way on the wheelchair if there were any on there. Then you would lower this bed down till the bed is even with the seat of the chair. This is the skill where you will actually roll the bed down instead of rolling the bed up. So now what I'm going to do is I'm going to also look for your shoes. Her shoes are under the bed. I'm going to remove them from under the bed and put them over here out of the way so that they won't be in my way. I'm then going to have to set her up in the sitting position to get her out of bed. So my controller's over here. Okay, I'm going to set you up. Are you okay? Okay. Okay. I'm going to walk back around here. I'm going to remove the covers from her feet. And remember, you want your back to be toward her. And everybody thinks their feet are ugly. There's nothing wrong with your feet. Okay, I'm going to pull my covers up here. I'm going to put one hand underneath this ankle, one underneath the other. I'm going to bend at my knees, swing her legs around. I'm then going to remove this pillow. I'm going to put one hand behind her shoulder here, one behind her neck. I'm going to bend at my knees and help her sit up. At this point is when you stick your hands underneath here and fix her gown because you don't want her to be exposed. I'm going to remove my covers. I'm going to ask her, can you slide to the end of the bed right here? Okay. Now I would pick up the shoes because I said you put them out of your way, but you don't want to put them so far out of your way. Can you put your shoe on? Okay. Can you slide to the edge of the bed because you want her feet to be flat on the floor before you try to transfer her. Now I'm going to remove my gate belt from me, holding the metal the whole time because you don't want it to flop around and hit her in the face. Then I'm going to ask her, can you open your legs just a little for me? And you're going to stick one leg between hers. You want her leg to be next to the wheelchair. I'm going to go underneath her arms, never over her neck with my gate belt. And I'm going to put the gate belt on her. Are you okay, Miss Smith?
Yes.
Okay. And you want to talk to Miss Smith throughout your procedure. I'm talking to you all because I'm explaining it. But you should be saying, okay, Miss Smith, how are you doing? Miss Smith, now we're going to put your gate belt on. Miss Smith, you'll just hold your arms up for me. So your conversation should be to Miss Smith the whole time. Then you're going to ask Miss Smith, can you put your hands on my shoulder? Never ask her to put her hands around your neck. You're going to bend at your knees with one of your legs between hers. You want your hands to almost touch in the back, but you want your hand to be cuffed underneath the gate belt like this. And you're going to say, we're going to rock, and on 3, we're going to stand up. 1, 2, 3. Okay? And you allow her to stand for a few seconds so that she's not dizzy. Ask her, are you dizzy? Okay. Just move toward the wheelchair for me. And she's going to move, and you're going to keep your foot planted between her legs. Okay? Now you're going to ask her, can you back up to the back of your legs, touch the wheelchair for me? Okay. Can you reach back and grab the handles? Okay. Can you sit for me? And I'm going to bend at my knees while she's sitting. I would then remove her gate belt. Do not pull your gate belt like this. Ask her to lean forward. Okay. And then you take it out. You would then replace the feet up on the wheelchair. Go ahead and put your belt back on after you step away from her because you don't want to hit her in the face with this metal. And then I let her know, Miss Smith, I'm going to go into the bathroom and wash my hands and take my gloves off so I can come back and give you your call light. So I go into the bathroom and I take off my gloves and I wash my hands. And then I come back over here and I get her call light. And I want to make sure she can reach her call light. So I'm going to pin it to her sheet here so it would be within reach of her. Now this is all your skill consists of, is transferring the client. And I'm just trying to make sure that the call light is closer to her. Here's your call light. If you need anything, my name is Teresa. I'm your CNA for today. Just give me a call. Goodbye.